Hello and welcome. I'm Dr. Sagar Parikh, professor of psychiatry at the University of Michigan. I'm here to have a very engaging talk about a problem that all of us face, and that is how to improve outcomes of major depression. And I'm delighted to be able to speak to an expert. Olivia, would you like to introduce yourself?
Yes, thank you, Dr. Parikh. My name is Olivia Eiler. I was diagnosed with major depressive disorder about a decade ago when I was in middle school, so around 13 or 14 years old. And currently, I am volunteering with the Depression and Bipolar Support Alliance. It is a national nonprofit with chapters all over the country, and they offer support groups as well as education and advocacy efforts.
That's great. And the topic of our discussion today is really how to personalize the treatment and ensure better outcomes. We will talk about ways that patients can be better advocates, how providers can be better communicators, and we will build this on the results of a survey that was done of individuals with depression who answered some questions about how to improve the care journey. Olivia, we know that the Therapeutic Alliance, that is the bond between the provider and the patient, is critical to ensuring a good outcome. What advice would you have for other people with depression about how to find the right kind of provider and how to know if the chemistry is right and if the link is going to work out?
I think it's crucial to find that right fit. If I was wanting to make a major life change, move, or attend a school or a new workplace, I wouldn't just open up the yellow pages and close my eyes and point. And so I don't think you should do the same thing with a medical provider either. I think it's really important to recognize your unique needs, and then also the unique specialties and experiences that different providers can bring. uh, Work until you find that fit. So I started seeing another counselor when I attended college, and he was very tuned in to the unique challenges that young adults and college students face. And so his experience aligned much more closely with what I needed. So I would stress that, know what you want out of it and don't be afraid to try again. Another challenge is the social stigma that can also come with seeking treatment for depression. And so, Dr. Parikh, how do you suggest patients experiencing that kind of pressure or stigma start or improve their care journey?
Well, the most popular doctor in town is Dr. YouTube. So I think it's worthwhile doing a Google search, perhaps looking up your favorite celebrity and typing in the words depression, because it's very likely that you'll find someone who's experienced depression and who has a YouTube video that says a little bit about their journey. Beyond that, I think looking for professional websites, particularly the DBSA website, but also the University of Michigan has a very comprehensive website talking about depression so that the person is informed and they see that, well, other people have experienced depression. Here's what it looks like. Here's what some of the treatments might be like. Having that information and knowing that you're not alone, I think those would be the ways to deal with the stigma. In trying to understand the barriers that people face when they're starting the journey for treatment for depression, um, there are a number of questions, and we've conducted a survey that helps guide us. Um, the survey asked a series of questions, and largely one of the focus areas was how do you get on the same page as a treatment provider? How do you work out a treatment plan that makes sense to both of you? So, how do you think that doctors or other providers could do a better job for patients so that patients feel, we're in this together, let's work out a treatment plan together?
So I think one of the major themes of our conversation today is just going to be unique experiences and personalization. And so it really goes, it all goes back to that for each person. There's no one size fits all plan. And so from the patient perspective, going into your first encounter with a new provider, it's really important to think about what you want out of that interaction. Do you want to learn new coping skills? Do you want to establish a crisis plan? Do you want to repair relationships with people you might have harmed when you were experiencing symptoms? Those are all very different goals that will have very different milestones for you. In my personal experience, obviously the patient has to help the provider with that process. You can't go in and expect them to have all of the answers when you don't give them the background information that they need. And this is a point where I also think it's really important to have your provider understand how symptoms manifest in your life. So I do kind of want to dive a little bit deeper into the numbers from that survey. 31% of people said that they wish they had more time to discuss their goals and their preferences for treatment with their provider. And then a nearly identical number, 30%, wish they had more time to talk about the pros and cons of the different kind of treatment options that were available to them. And so how do you feel that patients can be more active in voicing that they want to have those conversations? And then on the flip side, how can doctors help kickstart that conversation?
Olivia, I think you asked some very important questions. And I think the first thing is everyone wants a better experience in the discussion. Everyone wants it to be time efficient. So the number one thing, if you were going for diabetes care, of course you would go in there armed with a bunch of blood sugars that you might have had. And that would be an important thing to be able to discuss. In that same spirit, knowing the patient, knowing the kinds of symptoms that they've experienced, the intensity and the frequency, that's what they're going to be asked about. So be prepared. Do you have a good diary where you write down, for the last month, these are the number of days where I just couldn't get out of bed, or I had difficulty in the workplace. They may not need to report on all of the symptoms of depression, but just the 3 or 4 that are the most bothersome to them, they should have it measured in some way, like how many days a week I had that symptom, how intense it was. That is really efficient in a clinical encounter when a person knows these are the things that really bother me, and this is how intense it is, and this is how frequent it is. So that'll be one of the most important things. The second thing is I think it's okay to say up front in a discussion, by the way, my style is when we're talking about treatments, I like to hear about 2 or 3 different types of treatments, or I'm not particularly interested in one modality. Sometimes people start off saying, I'm not interested right now in medications, so please tell me about psychotherapy. Olivia, in this survey, I found one other thing that was very striking, and that is a lot of the people who answered were actually taking medication, but only half of them were either very satisfied or quite satisfied with their medication. About 37% thought that they could take it or leave it. They were kind of neutral about their medication. And about 15% were pretty unhappy about their medication. What can a patient say diplomatically to a provider to convey dissatisfaction with medication?
Dr. Parikh, I think it is so important to, as you were speaking to earlier, providers have this very specialized knowledge. And, for psychiatrists, for example, that includes medication. I think it's very important for the relationship between the patient and the provider to be a partnership. That's what it needs to be for treatment to be successful. It shouldn't be, a dominating conversation on one end or the other. I think it's great for providers to meet patients where they're at and say, here's what we know in terms of medical research, but ultimately, this is your treatment plan. And so you've got, the final call on this. As far as, the evolution of medication for patients, if you were to ask me right now, where would I fall in this survey? I would say I'm pretty satisfied with my medication. But if you had asked me 3 months ago, it would have been a different story. I would have fallen into the unsatisfied category. Sometimes antidepressants can stop working for people. for no reason. After 6 months or a year, it can be going great, and then it just doesn't help as much. And so I think I was really thrown off guard when I experienced that, and just wish more education was there on that side. Some people, that I've spoken to anecdotally have said they have persistent symptoms or side effects like difficulty concentrating or remembering things. So, how do you approach those issues first, before the medication even starts? And then, ongoing through the treatment process? How do you meet patients' needs in that regard?
So, in first choosing a treatment, I do ask them, what are the most important benefits they want? Like, what symptoms bother them the most and that they'd like to see get, diminished quickly? And secondly, what are the side effects that would be most impairing? And so, a common thing is a sedating medicine for a young mother with little kids around is not a good choice. So once we've identified what are the key symptoms to improve and what are the key side effects to avoid, we've set the stage. Then comes the journey when the person is actually taking the medication and has some residual symptoms. So I try to, again, have them prioritize which of the symptoms that you're now experiencing, symptoms or side effects, it could be one or the other, which are the most bothersome and which can you live with and which should we work on, and then we try and work on that. Another problem that we encounter in the treatment of depression is that people are well, they're actually in remission, and then they experience a relapse. What does a relapse really feel like to a patient, Olivia?
It can feel like, oh my goodness, I had made so much progress. I was feeling so much better. What happened? What went wrong? And it can be sometimes, depending on your relationship with your provider, it can feel almost embarrassing or shameful to really admit that. But it's so important to be honest. If you're not honest with your provider, they don't have the information they need to help you. And just going back to the first interaction between a patient and a provider, I think it is so important to set realistic goals because unfortunately relapses do happen. Something I like to say is wellness isn't a straight line, but it's trending upwards. So that means there's going to be some bumps and some setbacks along the way. I also think it's really important to develop a crisis plan if that is something that the patient needs.
Well, I hope you've enjoyed our discussion today, and here are some highlights. Number one, the treatment of depression, it's a team effort, and both providers and patients need to make efforts to collaborate better, and they can do so, number one, by being prepared for their encounters. So for providers, making sure that they've gotten the information they have in their records before they see the person, and for the person to have collected some information on the frequency and intensity of symptoms and also their treatment preferences. Olivia, what are some of the takeaways that you would have?
So my biggest takeaways are, like yourself, collaboration and teamwork is vital for a recovery plan. I also think, compassion and understanding for each other is really important. And I loved what you said about the patient needing to do some research up front. What do they want? What do they not want? I would also advise patients against feeling like they're the expert now because they read something on the internet. You also want to be, cognizant that not everything you see online is true. So make sure you're getting your information from good sources. And at the end of the day, it goes back to our first topic. If you feel that there's not that connection between yourself and your provider, or there's not a level of respect or open communication, I would say don't write off treatment as a whole. Just keep searching for a provider until you find one that really fits your unique needs.
Olivia, thank you for mentioning the connection. To our audience, I hope you've connected with us. Connection, connection, connection. That is the heart of a good therapeutic encounter and hopefully a good educational encounter. Thank you very much.